Let me hit the record button. Perfect. Today we are going to be discussing vertigo. You guys all see my presentation? Thumbs up. Perfect. Alrighty. So let's jump into this. This is actually one of my favorite things to treat. I don't know. I just found it very fascinating when we were learning about this that, we as physical therapists can actually treat this. So I think it's, pretty interesting. So first of all, what is it? Okay. Technically, it's called BPPV. Okay, it's a mouthful in and of itself. But it stands for benign paroxysmal positional vertigo, meaning it doesn't cause any further illness. It just kind of makes your head spin a little bit. It's temporary, and it's sudden onset, and it's related to a change in your body position. Okay. Oh man, that's unfortunate. 2 days in the hospital. If it's one of the simpler versions of it, it can be treated in just a few sessions of PT, and we'll get into that. But it is the false sensation of spinning. So a lot of people will kind of confuse it with dizziness. Dizziness is a little bit of a different symptom. Vertigo is kind of just like you feel like everything is around you is spinning around you versus kind of feeling woozy. Okay, so it's slightly different. It occurs here. So if you look right inside your ear, we have these semicircular canals. Okay. I'm sure you guys have seen pictures of these before. And you have this little cochlea thing here. This is all part of our, what we call the vestibular system, telling our brain where we are in space, whether we're looking up, down, left, right. It has these canals that have fluid in them. Okay, so this fluid is supposed to move smoothly through these tubes as needed. And there's little hairs throughout these tubes that kind of tell your brain which way the head's moving, which way the fluid's moving, and all that good stuff. Okay. Then we have these little crystals. Okay. These little crystals are supposed to be in this area here. Okay. And they're just for sensory. They're sensory mechanisms. Every once in a while, and some people will get these dislodged. Okay. And so if one of these crystals starts finding its way into one of these tubes, okay, we get the BPPV. Okay, so some of our fancy terms. If it's found within this canal, okay, we call it a canalithiasis. Okay, and if it gets all the way up here, if it gets all the way stuck into the next little area, it's called a cupula, so cupulolithiasis. Okay, so if you ever get diagnosed with this, and a physician ever tells you one of those two terms, those are just the fancy word for how far basically that crystal has gone. Okay. So the idea behind physical therapy is we can reposition that crystal. We can get that crystal to go back where it's supposed to be. Okay. So the first thing we do is a test. It's called the Dix-Hallpike Test. Okay. It is moderately aggressive because you kind of almost, without, for lack of a better word, need to be slammed back into the table. You just need to lie back very rapidly, very quickly. Okay. So you'll turn your head to the right about 45 degrees, and then you'll be asked to lie all the way down on your back to where your head is kind of extended past the table a little bit. Okay. So that's the test. That's the position we put you in. And then let's see if these videos work. So this is what we're looking for once we put you in the position. If you watch this patient's eyes.
This Dix-Hallpike test is testing the left ear, which is the downward ear. It is strongly positive, which is diagnostic for posterior canal BPPV. When she is placed in the Dix-Hallpike position, nothing happens for the first 3 seconds. And then...
I'm dizzy.
You can see it there.
I'm very dizzy.
She becomes very vertiginous and has vertical upward nystagmus with a rotatory component towards the downward ear, which is the left ear.
Okay, the rest of that's just a bunch of fancy stuff. But you can see there that that patient gets really, they start having reports of feeling dizzy. The eyes twitch in what we call this nystagmus. Okay, so that's the sign that I'd be looking for. If your eyes start twitching, I then look at your eyes to see which direction. Is it up and down? Is it mostly up, mostly down, left or right? I'm looking for that eye twitch in a certain direction to kind of determine which of the canals is being affected and potentially has one of those crystals in it.
This Dix-Hallpike.
Nope, I don't want you to do that again. Okay. These are all just the fancy names. I wanted to put them in here of what we're looking for. So we're looking in the 3 canals. There's either posterior, so it's the canal that runs forward and backward, anterior, and then there's the one that's, in the horizontal plane. Like I said, canalithiasis or cupulolithiasis, we, based on how long your eyes twitch, so if it's more than 30 seconds, we know it's pretty lodged, so it probably made it to that next little section. Otherwise, if it's, around 30 seconds or less, then it's probably in one of the canals, so it's a little bit easier to treat, okay? It can be on both sides. It can be one side or both sides, okay? Left or right. So, for example, one might be diagnosed with left unilateral posterior canalithiasis. Bunch of big fancy words to say you got a crystal stuck in one of the canals. So the way you go about treating it, this is really, this just super fascinates me. We go back into that Dix-Hallpike Test position. Okay, so the patient's seated up, sitting up, looking at 45 degrees, and you lie them back with their heads over the table. Okay, you stay there for 30 seconds to a minute, and then, so you can kind of see the picture here, and I'm gonna show you a really cool video right after this, but essentially we're starting to get that crystal to flow around the canal, and then it should settle in the bottom. Now we're going to rotate again for another 30 to 60 seconds. Then you're going to rotate again, and then you're going to sit up. So here's a video of exactly what's happening with that crystal as you go through this treatment. So this video is about 2 minutes long, so I'm going to have you guys watch this one. I'm going to fast forward a little bit because I've already talked about it.
However, should a crystal called an otolith gets displaced into the posterior canal of the inner ear, BPPV dizziness occurs. Fluid movement occurs due to the crystal rather than head turns, causing the brain to think movement has occurred even though none has happened. The Epley maneuver is performed to treat this posterior canal BPPV by trying to get the loose crystal out of the canal. This maneuver is started by turning the head 45 degrees and the body laid back such that the head is extended about 20 to 30 degrees. If BPPV is present, eye twitching called nystagmus will occur. After 30 to 60 seconds, the head is turned at 90 degrees to the opposite side and held for another 30 to 60 seconds. The head is then further rotated another 90 degrees, accomplished by having the patient turn onto their side, which is then held for another 30 to 60 seconds.
I'm going to jump a little bit
Going
here.
on with these position changes. Essentially, the head is moved in such a way to manipulate the crystal to fall towards the canal opening. With each position change, it takes about 30 to 60 seconds for the crystal to settle into the most dependent position in the canal. If turns are made before the crystal has a chance to settle, the crystal may fall back the wrong way and the maneuver will fail. It's also important that the head positions are angled correctly, or else the crystal will not settle to the correct position in the canal and the maneuver will fail. Also, if the position changes are done too slowly, the crystal may not settle quickly enough from lack of momentum and the maneuver will also fail. Once the crystal falls out of the canal, the dizziness should resolve if due to posterior canal BPPV.
So I don't know about you guys, but that's extremely fascinating to me. I just think it's so cool that we can just lay you in a position, roll you a few times, and all of a sudden that crystal's back where it's supposed to be, and you don't experience that dizziness anymore. I have literally seen this condition treated in one session, okay? I personally have treated several patients in 3 to 4 sessions, okay? It takes about 7-8 minutes to go through these little maneuvers and, get you well on your way to treatment. And it's life-changing. I've had a patient come to me. She wasn't able to wash her hair for years because looking up and back to wash her hair would make her extremely dizzy and nauseated, that she finally had to stop doing that. She had to find other ways to do it. And she wasn't even in my clinic to be treated for that. She was there for low back pain. But I noticed the sign And she was giving me all the signs and symptoms of it. So I took her through a test. 4 sessions later, the next time she came in pretty much crying because she was so thankful that she was able to wash her hair the way she wanted to wash her hair. So it's not something you should be forced to live with. If you think you have something like this, let me know. I would love to take a look at you. I pretty much touched on all this stuff already. Typically it takes 3 to 6 sessions. Each session is maybe 10 minutes long. And then, I can go through a home maintenance program for you to help you tune yourself up anytime you feel like you might be getting some symptoms setting in. Okay. Other than that, that's it. That's vertigo. That's the treatable vertigo from physical therapists. There are, types that are not physical like that. Sometimes there are chemical issues that I cannot treat, but it's worth, coming down and getting checked out if it's something you have. Let me take a look at it. Any questions? Cool. I see we have a few people here. Super short today, only 11 minutes. But still a cool subject in my mind. People with nystagmus more susceptible to experiencing vertigo. I have 2 children with visible disabilities and a major component. There can be a correlation. Yes. So if you have nystagmus, that can trigger the vertigo symptoms, but it may not necessarily be treatable with, what I'm going over. But yes, there is a correlation between the two. Would this cause a person to black out? I haven't heard of people blacking out from it. It's just an extreme nausea, like you were just on a roller coaster for 30 straight minutes and just spinning around and around. But that's not something I've heard of, but I can't say that it's not possible. I dare that people that go on a cruise experience that. I heard. It's possible. So that's part of the symptoms that you're experiencing. So those canals are supposed to move the fluid. And if your if your eyes aren't perceiving the same thing that your inner ears are perceiving, yeah, you can feel nausea. You can feel like the world is spinning, and that's part of the seasickness. Mm-hmm. I did have BPPV. He blacked out. What are some other causes? That would be outside my area of specialty. I know the physical aspect of it and how the crystals can move through the canals. Otherwise, if it's not based on BPPV, so the key word in there is positional. Because it's positional, that's something a physical therapist can treat. Otherwise, it may take medication. That's outside my scope, unfortunately. Okay, make sure you guys get signed in if you want your points, especially for Pro Club. If there are no other questions, I'll hang out for a few more minutes. Otherwise, you are all free to go. Thanks for stopping, guys. You're welcome.
That was interesting.
Very welcome.